Introducing the luminous ultrapulse fractional CO2 laser device. With more than 100 FDA-cleared indications, the ultrapulse is considered the gold standard of CO2 lasers. This video is intended as a general overview and to serve as refresher training. This training video is not intended as a substitute for hands-on training by a qualified professional. The ultrapulse features two skin resurfacing scanners on one platform. The Active FX scanner is a superficial fractional handpiece that targets fine lines and dyschromias and features a 1300 micron spot size. The Deep FX scanner is a deep fractional handpiece that targets deep wrinkles and scars and features a 120 micron spot size. All persons operating the ultrapulse laser system or in the vicinity of the laser must be aware of the potential hazards. The ultrapulse system is classified as a Class 4 laser by the Center for Devices and Radiological Health and as a Class 4 laser by the European Laser Safety Standard EN 60825-1. The ultrapulse system is to be operated in an enclosed room with protective eyewear for all persons, including the patient, whenever the main power and key switch are turned on. The protective eyewear must have an optical density of 4.88 or greater for a wavelength of 10,600 nanometers. For users who must comply with EN 207, the safety eyewear must have a protection class of L4. For maximum safety, opaque or metal goggles, or protective eye pads, or corneal shields must be worn by the patient when the patient's eyes are potentially within the nominal hazard zone, or NHZ. Compliance with ANSI Z136.3 and EN 60825-1 requires that laser safety signs be posted at all entrances whenever the laser is in use. Personnel operating the ultrapulse should be aware of the following safety considerations and potential fire hazards when using a surgical CO2 laser. A CO2 laser beam can ignite most non-metallic materials. Use fire-retardant drapes and gowns. A UL-approved or equivalent fire extinguisher and water should be readily available. Use of the laser in the presence of oxygen increases potential fire hazard. When performing a laser procedure, the physician and anesthesiologist should carefully consider airway management. Oxygen concentrations should be as low as clinically permissible during airway laser procedures. During fractional procedures, each laser pulse ablates a column of tissue causing volumetric skin reduction. The ablation removes surface discolorations and deposits heat deep in the dermis. The deep heating causes immediate collagen contraction and long-term collagen remodeling. The thermal relaxation time of pulsed CO2 laser-heated tissue is about 0.8 milliseconds. In effect, for the CO2 laser wavelength, we must deliver the necessary 5 joules per centimeter squared in at most a 0.8 millisecond pulse, preferably less, to minimize injury to the underlying tissue. If the ablation threshold of 100 degrees Celsius is not reached in less than the thermal relaxation time, thermal damage, char, and other complications can occur. A small amount of thermal damage is ideal, as it coagulates small blood vessels and stimulates the body's wound healing response. The ultrapulse delivers a fluence of 14.5 joules per centimeter squared at well below 0.8 milliseconds, ensuring safe and efficient ablation of tissue. The laser status icons display the laser status, standby or ready. Press the Ready button to select Ready mode. Press the Standby button to select Standby mode. In Standby mode, the foot switch is disabled and the safety shutter is closed. No treatment beam is available. At system startup, the laser automatically goes into Standby mode. In Ready mode, the foot switch is enabled and the treatment beam is available. You can view the treatment screens in either English or icon mode. In English mode, the treatment setting buttons are labeled in English. In icon mode, the buttons are labeled using symbols. Press the Options tab to view the options screen. Press the English button to select English mode. Press the Icon button to select Icon mode. During some procedures, the aiming beam may obstruct the view of the treatment site while lasing. The aiming beam can be either on or off while lasing. To turn on the aiming beam, press the On button on the aiming beam on-off control. To turn off the aiming beam, press the Off button on the aiming beam on-off control. You can select a blinking or continuous aiming beam. When the blink option is on, the aiming beam pulses on and off. When the blink option is off, the aiming beam is continuous. To set the aiming beam to blink, press Options on the main screen. Then press the On button on the blink control. To set the aiming beam to continuous, press the Off button on the blink control. Adjusting the system volume. The laser system emits a single tone with every control screen selection. The laser system emits a long, low tone when a minimum or maximum setting is reached or when an error has occurred. Press the Options tab to view the options screen. Press the plus and minus buttons on the volume control. Active FX is a superficial fractional treatment ranging from depths of 10 to 300 microns that improves the look of fine lines and dyschromias. The Active FX utilizes a 1300 micron spot size with a collimated treatment beam, ensuring that the spot size and fluence remain constant at virtually any distance from the target tissue. Treatment densities with the Active FX scanner can reach up to 100% for improved outcome. Make sure the laser is in the on position to begin operation. When the laser is not in use, turn the switch to the off position. Make sure the remote door cable is attached correctly. This will enable the foot switch to work. To assemble the Active FX handpiece, use the inner tube to screw the handpiece tip onto the handpiece body. Ensure that the inner tube, handpiece tip, and handpiece body are securely locked into place prior to use. Use of the smoke evacuation spatula tip is optional. Before attaching the Active FX handpiece or any other scanner to the laser, and before connecting and/or disconnecting the communication cable to the scanning accessory, always ensure that the laser system is set to scanner pause mode in the options screen. Attach the Active FX scanner to the laser articulated arm by screwing the handpieced body onto the threaded end of the articulated arm. Ensure the Active FX scanner is secure and will not loosen during use. Press the Restart button to resume scanning operation. Note that if the laser system is turned off during scanner installation or replacement, scanner pause is obviously not required. Next, connect the scanner communication cable to the Active FX scanner. The scanner communication cable provides constant communication between the laser and the Active FX handpiece. First, insert the communication cable plug into the communication cable receptacle on the rear of the laser console. Then, insert the opposite end of the communication cable into the cable receptacle on the Active FX handpiece. Note, the communication cable should be secured along the length of the articulated arm with the communication cable clips. Attach the smoke evacuation tubing to the Active FX scanner. Turn on the laser with the laser key switch as instructed in your ultrapulse laser operator manual. Wait a few minutes while the laser performs a self-test. The red aiming beam should exit from the articulated arm's end joint or Active FX handpiece if connected. If necessary, adjust the aiming beam intensity with the touchscreen controls. To activate the ultrapulse CPG controls, press the CPG on button on the control screen. The CPG controls change color to indicate they are active. The Active FX scanner has 7 different pattern shapes from which to choose. Select the desired pattern shape from the treatment screen by pressing the left and right arrow buttons on the pattern shape selector. An outline of the selected pattern shape appears in the pattern display. The pattern shape number appears above the pattern shape selector. Pattern density refers to the overlap of individual treatment spots in a pattern and can range from -10 to 50% density with the Active FX scanner. Select the desired pattern density by pressing the plus and minus buttons on the pattern density selector. The selected density number appears in the pattern density display. The pattern density setting takes precedence over the pattern size setting. When the CPG is active, the average pattern fluence appears in the CPG display. Each pattern on the ActiveFX pattern chart has a unique 3-digit number. The first digit is the pattern shape number. The second digit is the pattern size number. The third digit is the density number. To set the repetition rate or average power, press the Rate or the Power button. The selected button highlights to indicate whether rate or power is active. Then select the desired rate or power by pressing the plus or minus buttons on the Rate Power bar. To set the energy or fluence, press the Energy button or the Fluence button. The selected button highlights to indicate whether energy or fluence is active. Then select the desired energy or fluence by pressing the plus or minus buttons on the Energy Fluence bar. The ActiveFX scanner can be set to single pattern or to a repeat pattern mode. In single pattern mode, the ultrapulse delivers one complete treatment pattern each time you press the foot switch. To deliver additional patterns, release and press the foot switch again. Select single pattern mode by pressing the off button on the repeat delay bar. In repeat pattern mode, the ultrapulse repeatedly delivers patterns at the selected interval until the foot switch is released. For example, if you select a repeat delay of 1.5 seconds, the laser will deliver a complete pattern, wait 1.5 seconds, deliver another complete pattern, wait 1.5 seconds, and so on, repeating the cycle until the foot switch is released. Select repeat pattern mode by pressing the on button on the repeat delay bar. Set the repeat delay interval by pressing the plus or minus buttons on the repeat delay bar. Before beginning a procedure, always preview the pattern. To do this, moisten a tongue depressor with a non-flammable solution. Then set the laser energy to 125 millijoules. Next, position the CPG so that the aiming beam is centered on the depressor. If you are using a spatula tip, ensure that the tip is touching the tongue depressor. If you are not using a spatula tip, position the distal end of the CPG handpiece approximately 50 millimeters or about 2 inches from the tongue depressor. Press the Ready button to place the laser in ready mode. Then press the foot switch. If the repeat delay is off, release the foot switch when the treatment beam stops. If the repeat delay is on, release the foot switch after observing the on-set time delay between the pattern. Examine the laser burn pattern. Adjust the pattern size and pattern density as required. Adjust the repeat delay setting if desired. If the pattern is adjusted or the repeat delay setting is changed, repeat the preview procedure. Finally, press the standby button to place the laser in standby mode. ActiveFX mode is available only when the CPG is connected to the ultrapulse laser. To enter ActiveFX mode, press the ActiveFX button on the ultrapulse control screen. The default ActiveFX treatment settings automatically display. When working in ActiveFX, also verify Cool Scan mode is on. In Cool Scan mode, the laser delivers the treatment beam to non-contiguous spots within the selected pattern to increase patient comfort. To turn Cool Scan mode on or off, press the Options tab at the top of the control screen to view the options screen. Press the Cool Scan On button to activate Cool Scan mode. Press the Cool Scan Off button to deactivate Cool Scan mode. When Cool Scan mode is deactivated, the treatment beam is delivered in a linear, row-by-row sequence to spots within the pattern. Before replacing any scanning accessory at the end joint of the articulated arm, DeepFX or UltraPulse CPG, the scanner software module needs to be paused in order to prevent possible damage to the system. Begin by pausing the scanner software module by pressing the pause button on the option screen. Next, disconnect the communication cable from the scanning accessory and disconnect the accessory from the articulated arm. Connect the desired scanning accessory to the articulated arm and connect the communication cable to the accessory. To restart the scanner software module after you have connected the new scanning accessory to the end joint, press the Restart button on the options screen. DeepFX is a deep fractional treatment with treatment depths ranging from 1,000 to 2,500 microns that improves the look of deep wrinkles and scars. The DeepFX scanner utilizes a 120 micron spot size and can treat at densities of up to 25%. Active FX and Deep FX can be combined to form Total FX for total outcomes with dyschromias, wrinkles, and scars. Make sure the laser is in the on position to begin operation. When the laser is not in use, turn the switch to the off position. Make sure the remote door cable is attached correctly. This will enable the foot switch to work. To prepare the Deep FX microscanner for use, disconnect the lens assembly's protective cover by pressing the two tabs and pull it out. Set the protective cover aside for later use. Check that the microscanner's components are secured to each other and that there is no rocking motion between the scanner and lens assembly. If the parts seem loose, tighten the locking wheel by turning it in the direction of the close arrow. If the blue thread adapter is not already connected to the scanner's entry port, connect it by screwing it onto the port. Screw the articulated arms end joint connector into the blue thread adapter on the scanner's entry port. Ensure that the connection is secure and will not loosen during use. Next, check the surface of the lens for dirt, debris, or damage to the optical coating. Clean or replace the lens if necessary. Unpack the desired disposable tip and insert its proximal end into the lens assembly until you feel it snap into place. Connect the purge air compressor's tube to the tip's purge air nipple. Connect the Deep FX microscanner's communication cable. With the SurgiTouch Plus specialty selection screen displayed, select the aesthetic specialty. The available aesthetic applications will display on the Aesthetic Applications selection screen. Select the Deep FX application. The Deep FX setup screen appears, displaying the default beam's scan, shape, size, density, and laser micro-pulse energy. There are 4 pattern shapes to select from: donut, square, rectangle, and line. Each pattern shape has several sizes to select from. The outer diameter of the donut can be configured from 4 to 7 millimeters. The size of the square can be configured from levels 2 through 10. The size of the rectangle can be configured from levels 2 through 10. The size of the line can be configured from levels 4 through 10. The following pattern chart tables display all shapes and sizes that are available with the Deep FX microscanner. The number of pulses per scan can be changed to fit treatment needs. The pulses number value denotes the number of times the laser beam will strike each dot in the scan before moving on to the next dot, and so forth, until the beam scan is complete. The available range of pulse rates is 1 to 2. For example, when the pulse value is 2, the laser beam will strike twice in the same location, or dot, move on to the next dot, and strike twice, and so on. Press the plus or minus buttons to display and select the desired number of pulses. The beam scan's density denotes the percentage of coverage within the scan's treatment area. The available beam scan density factors are 5% to 25%. Press the plus or minus buttons to display and select the desired beam scan density. When the ultrapulse SurgiTouch system is turned on and the Deep FX application is requested, the following default settings will always appear. The right-hand column displays the entire available range of the operating parameters. The time interval between beam scans can be configured from a minimum of 0.3 seconds, maximum of 5 seconds. If a delay between beam scans is desired, press the on button in the repeat delay row and press the plus or minus buttons to display and select the desired delay interval. In this case, scans and delays will continue as long as the foot switch is pressed. If no repeat delay is desired, press the off button in the repeat delay row. In this case, a single scan will be fired each time the foot switch is pressed. To fire another scan, release the foot switch and press it again. The pulse delivery rate setting can be configured from a minimum of 150 Hz to a maximum of 600 Hz. Press the plus or minus buttons to display and select the desired pulse rate setting. Please refer to the current ultrapulse treatment guideline for treatment protocols. For additional information, refer to the System Operator's Manual and Clinical In-Service Presentation, or contact your local Luminous representative.